Today we are going to discuss the remaining part of the heart, that is after the completion of the introduction of the heart and explanation of the right atrium. We are going to deal the today explanation of the right ventricle, internal structure and features of right ventricle, and the features of the external and internal features of the left ventricle. So my dear students, we have to explain as the ventricles in the total 4 chambers of the heart. We have the right ventricle. This is the outline where you can see the right ventricle. This is you are going to get, and this is the chamber which is you get the left ventricle. When we study the right ventricle, so right ventricle you have to tell it is one of the triangular chamber which is present in the anterior aspect of the heart. As it is a triangular in shape, so it is forming the sternocostal surface and diaphragmatic surface, so that almost all the sternocostal surface and diaphragmatic surface are formed by the, that is a right ventricle. Also it forms the inferior border. In this you have to mention the what are the points we have to explain in the external features of the heart. In the external features of the heart, as you get that this is all triangular in shape of the, that is the right ventricle. Then this right ventricle, as it is receiving the blood from the right atrium. This is the right atrium which is pumps the blood into the atrioventricular orifices, that is the tricuspid wall. That is the blood coming from the right atrium to the right ventricle, and that is the entry of the blood which is enters into the, that is the right ventricle. In this you have to explain the first part, that is the introduction of the right atrium. So in the introduction of the right atrium you have to explain first it is a triangular chamber which is anteriorly forming the sternocostal surface, inferiorly diaphragmatic surface, inferior border, and as the blood from the right atrium entering into the right ventricle, and this right ventricle that is reaching blood from the right atrium by the, this is the one orifices which is, you can remember, it is the tricuspid wall or the right atrioventricular orifices. Then I have told the blood entering into the right ventricle. This right ventricle which pumps the blood to the pulmonary trunk. This is a pulmonary trunk which is, you can see, it is a pulmonary trunk. And these are the walls which are we are going to get. These are the semilunar walls. You are going to get the, that is a semilunar wall. You can see semilunar wall which are you are going to get in the, that is a semilunar. There is a cusp like which is you are going to get in the pulmonary trunk. So 2 types of orifices, atrioventricular orifices and semilunar orifices. That is semilunar orifices comes in the pulmonary trunk as well as the aortic orifices. Okay. So first in this you have to remember the external features of the right atrium. It is forming sternocostal surface of the heart, inferior border, and I have told it is also forming the diaphragmatic surface. Then going to the internal structure of the right ventricle. So internal structure of the right ventricle, how you have to explain? You are going to get the, that is a inflowing part is rough and the outflowing part is smooth. So you are going to get in the internal structure of the right ventricle are, that is it is divided into 2 parts, inflowing rough part and outflowing smooth part. This inflowing rough part which is consists we call as a trabeculae corneae. These all rough part which is are seen here, these rough portion of the heart inflowing part, this is known as a trabeculae corneae. So you are going to get the trabeculae corneae, that is a rough part. Then that is a divided, this all is divides into a, that is a again into consisting of the chorda tendineae. So you are going to get the chorda tendineae are the, we are going to get the elevated part which are we are going to call as a bridges. So one end is attached to the elevated part, fixed elevation, that is we are going to call as a papillary muscles. We are going to get papillary bands, and the elevated part which is we call as that is the chorda tendineae. So chorda tendineae are the bridges. So rough part which is consists the trabeculae corneae. This trabeculae corneae consists of the three parts: ridges, bridges and pillars. So ridges are those which are the fixed elevation, and bridges are the which is connecting to the one end to the cusp and another end to the papillary, that is a papillary muscle. So that tendon which is, you can see this is a bridge like thread like connected, and that is we call as a chorda tendineae. So chorda tendineae are the bridges. Then we have the fixed elevation are the ridges, and that is a rough part of the interior of the right ventricle. And we are going to get the here papillary muscle, papillary bands. We are going to get anterior, posterior and septal. Three papillary bands which are present in the that is a right ventricle. So whatever you are going to get, these are the papillary bands which is you can get on the anteriorly. This is a papillary band anterior. Then we get the posterior, and one is a septal. Septal in between the ventricle. Right and left ventricle separated by the septal wall. That is we get the septal. Then next you have to explain what are the openings inside the right ventricle. You get the first one, that is a right atrioventricular orifices, that is we call as a tricuspid wall. That is a blood, deoxygenated blood coming to the, that is a right atrium. Right atrium pumps into the, that is a right ventricle. Right ventricle receives the blood from the right atrium through the, this is a one which is a right atrioventricular orifices or the tricuspid wall. Then blood enters into the right ventricle. Right ventricle pumps into the pulmonary trunk. So this is the one which is you have to trace into the pulmonary trunk. And this deoxygenated blood from the pulmonary trunk going to the lung for the oxygenation. It divides pulmonary trunk into right and left pulmonary arteries. Okay. So this is the one you have to remember about the triangular chamber. It is forming sternocostal, inferior surface, diaphragmatic surface and inferior border. And most important, blood received from the tricuspid wall, from the right atrium to the right ventricle. Right ventricle pumps into the pulmonary trunk, that is going to the lung. So this is the main important points of the right ventricle. Going to the left ventricle, when you see this is the left ventricle major part which is you can outline. Left ventricle, it's one of the left chamber of the heart, which is receiving the blood from the whatever we have here, the left atrium, and left atrium, whatever the receiving the blood from the pulmonary veins, that is bringing the oxygenated blood to the, that is a left atrium, and this is a left atrium. This left atrium contracts, pumps the blood into the left ventricle, and this left ventricle pumps into the aorta. So that is your aorta. So this is the area which is we get the, this is one which is a left ventricle elongated chamber, whereas a right ventricle I have told it is a triangular chamber. So left ventricle is a elongated chamber which is on the left side, and it is making the sternocostal surface and inferior or diaphragmatic surface, and it is forming the, that is the apex of the heart. So here left ventricle forming the apex of the heart and inferior border of the heart, sternocostal surface of the heart and diaphragmatic surface of the heart. So that is the external features of the left ventricle. So I have told the on the upper part of the left atrium we are going to have there is a projection is known as a left auricle. So that is the left auricle. So left ventricle, how we are going to explain? It is the left chamber of the heart which is receives the blood from the left atrium to the left ventricle, bicuspid wall or mitral wall or the left atrioventricular orifices. Then it is the oxygenated blood which is pumped from the left ventricle to the, that is through the aorta. This is the aorta which is you are going to get ascending aorta, arch of aorta and descending aorta. So aorta arising from the left ventricle, and it will pumps the blood oxygenated to the all over the body. So this is about the left ventricle introduction and external features of the left ventricle. Going to the internal structure of the left ventricle. How we have come across the right ventricle, that is I have told this is the inflowing rough part, inflowing rough and outflowing that is smooth part, that is in the right ventricle. Like that only we are going to have here in the left ventricle. We are going to have the lower rough part and upper smooth part. So you are going to get, this is the aorta. So we are going to reach into the aorta to the left ventricle. That is in the form of, that is the orifices we are going to have. In this we are going to have the aortic orifices here. Okay, that is the one which is going to the in the aorta. So that is coming to the here, that is the aorta. So here are also coming here. So you are going to get the aortic orifices here. So in the heart, left ventricle, it is having the internal structure, lower rough part and upper smooth part. Upper smooth part, which is we are going to get near the aortic orifices. So next we have to remember about the left ventricle has a lower rough part, which consists the again trabecular cornea. Those are the we are going to get the trabecular cornea. Then we have the ridges, bridges and pillars, like we have in the that is the right ventricle. So left ventricle also lower rough part, upper smooth. Lower rough part consists the trabecular cornea and trabecular cornea. They are the three parts which are we are fixed elevation we get, that is the ridges, and bridges we have, these are the connecting to the cusp and papillary band. Then we have the trabecular cornea are these parts, three, ridges, bridges and pillars. So we have the here fixed elevation ridges. Bridges are the, we call as the chorda tendon. Then one end attached to the cusp of the valve, that is we call as a trabecular cornea, and the bridges are called as a chorda tendon. So in the interior of the left ventricle, what it consists? It consists the lower rough and upper smooth. Lower rough is consisting ridges, bridges and pillars. So one we are going to have the blood from the, you get the, this is the one which is you are going to get as the chamber, that is the left atrium. From the left atrium we are going to get the, that is the one wall which is we call, that is a bicuspid wall, or the we are going to get mitral wall that opens into the, that is the left ventricle. So blood from the left atrium, oxygenated blood received from the pulmonary veins from the lung coming to the left atrium. Left atrium pumps blood into the left ventricle. So this left ventricle receives the oxygenated blood from the left atrium to the left ventricle, and left ventricle pumps the blood into a, here we have the aortic orifices, as we have come across the aortic orifices. So internal structure of the left ventricle are, you have to tell the, it is having the lower rough, upper smooth. Lower rough part which is there, that is consisting the ridges, bridges and pillars. Here only we have the two papillary muscles, only two we are going to get, that is the two papillary bands we are going to get. And in the left that is a ventricle, we are going to get even moderate current. But in the left ventricle we are going to have the two anterior and posterior papillary muscle or band we are going to get in the two bands in the, that is the left ventricle. So lower rough part and upper smooth part. Lower rough part is having the ridges, bridges and pillars. So bridges are called as the chorda tendon. These are the bridges. Two ends connected, you can see one end is attached to the papillary muscle, another end is attached to the cusp of the wall of the ventricle, atrioventricular orifices, and these are called as bridges. So these are the bridges or the chorda tendon. So this is you have to remember in the left ventricle. So what is the difference between the right ventricle and left ventricle? So right ventricle, you are going to get it as a triangular chamber. and the left ventricle is a elongated chamber. Then right ventricular wall, when you see, this is a 1:3 thickness. See, thickness of the left ventricle wall is thicker. That is a 1:3. That is a 1:3. 1 mm is there, or 1 mm is there means it will be the 3 mm. So the wall of the right ventricle is thin than the left ventricle. Then you get the almost all the in the right ventricle forms the sternocostal and inferior or diaphragmatic surface. Left ventricle, it forms the sternocostal surface, diaphragmatic surface, left surface, and both are forming the inferior border. Next, you have to remember the almost all the right ventricle consists the deoxygenated blood and left ventricle consists of oxygenated blood. And we have the 3 papillary muscles, anterior, posterior and septal, and 1 moderate band in the right ventricle, and left ventricle which is consists the 2 moderate, that is a papillary bands. So that is the anterior and posterior. Then right ventricle has the inflowing rough, outflowing smooth. Then they are separated by interventricular crest. Then in the left ventricle, lower rough and upper smooth. So this is the way you have to remember about the difference between the right ventricle and left ventricle. So apex of the heart is formed by the left ventricle. Sternocostal surface, inferior border is formed by the, that is the, we have the, that is the right ventricle. Okay. So with this you can understand the, from the right ventricle pulmonary trunk is arising, and from the left ventricle we are going to get the aortic orifices arising. So aorta is beginning from the left ventricle. So these are the points you have to remember in the, that is the difference between right ventricle and left ventricle. Then going to the next part, which is we are going to get, that is the one which is a left ventricle. So left, after the left ventricle above chamber we have the, that is a, when you see this is a posterior part, that is we call as a nerve, which is a base of the heart is formed by the, that is the left atrium. Now we are studying with the left atrium briefly. So this left atrium, which is a posterior most chamber of the heart, which is forming the upper border, and most important is left atrium forms the base of the heart, that is a one, and it is forming the posterior wall of the left atrium forms the anterior wall to the oblique sinus of the pericardium, anterior to the oblique sinus of the pericardium and posterior wall of the atrium. Then anterior wall, which is forming the septal wall. Septal means 2 atrias are separated. When you see interior here, we are going to get the septal wall, 2 atrias are separated. That is we call as a septal wall. When you see the left atrium, it is a quadrangular chamber, 4-sided like. When you see the here on this quadrangular chamber, and pulmonary veins bringing the oxygenated blood from the lung to the left atrium. So left atrium receives the 4 pulmonary veins from the lung bringing the oxygenated blood to the, that is the left atrium. So left atrium is forming the base of the heart. So that is very important. Then going to the internal structure of the left. So there are total 4 openings, right superior inferior pulmonary vein, and we have the left superior inferior pulmonary vein. Here you have the right, and these are the pulmonary veins. So they are opens into the left atrium. So when you see the internal structure of the left atrium, that is almost all chamber of the left atrium is smooth. Almost all interior you get the smooth chamber. And we have the orifices, which is a bicuspid wall, that is a opening which is you are going to get in the, that is opens into the left ventricle. So we get the mitral wall or the bicuspid wall opening, that is one. Then we have the aortic opening, which is the beginning of the aorta in the left ventricle. But as you are comparing with the that is the left atrium, quadrangular chamber receives the superior inferior pulmonary vein, 4 pulmonary vein, bringing the oxygenated blood to the left atrium, and that is forming the base of the heart and the anterior wall to the oblique sinus of the pericardium. And we have the anterior wall of the atrium forming the septal wall, and the posterior wall is related to the oblique sinus of the pericardium. Then interior, I have told, it is having the very smooth chamber. Inside we have smooth chamber, except it is having the, on the upper part, it consists of the, that is a, this is a left auricle. On the appendage like growth like, we have the, that is a left auricle. Then here you see the left auricle where, here you get the, this is the left auricle. So when you see the left auricle, so interior of the left auricle, also it is having the one which is a muscular ridges like those we get. But you have to remember, in the left auricle itself, it is having the musculopectinity. So musculopectinity in the right atrium, they are the more which are present musculopectinity, more. But as in the left atrium, they are very less and they are present only near the auricle. So near the auricle, this is the auricle which is we are going to get. Near the auricle, we have the muscular pectinity. And whatever the we call in the right atrium, this is a fossa ovalis in the right atrium, and this is a fossa ovalis, and that will be forming the annulus ovalis, or annulus ovalis and fossa ovalis in the right. In the left, we have here the, that is a fossa lunata. We are going to get the fossa lunata. So this is a fossa lunata in the left atrium, and same part which is in the right atrium, it is forming the fossa ovalis and annulus ovalis. So when you go to the most important part in the interior of the left ventricle, 4 pulmonary veins opening, smooth chamber, and near the auricle, it is having the musculopectinity, and it is having the depressed part which is we call as a fossa lunata. So that is you have to remember in the fossa lunata. So difference, how you are going to differentiate the that is you get in the right atrium and left atrium. So right atrium, you are going to get the maximum interior. We have the, when you get the quadrangular chamber, we are elongated chamber we get in the right atrium. Then left atrium is a quadrangular chamber. Here right atrium receives the openings of the superior vena cava, inferior vena cava, making the shallow groove, that is sulcus terminalis. Then auricle is present on the upper part of that. This is the right auricle. When you go to the left atrium, this is the quadrangular, and left auricle also situated here. Left auricle, this is a part which is we get as the left auricle. Interior of left auricle, we have the musculopectinity. Inside this, you have the muscle like which is structure. You get those are we call as a musculopectinity. Okay. Then I have told 4 pulmonary veins opening here in the left atrium, and right atrium receive the superior vena cava and inferior vena cava. Then as you get the right atrium, fossa ovalis, annulus ovalis. In the left, we are going to get the fossa lunata. Okay. Vena cardi minimis are present in the right atrium, and they are absent or not less in absent in the left atrium. Okay. So major left atrium, interior smooth, and at the auricle it has a small musculopectinity. Then fossa lunata. They are the characteristic features of the left atrium. Then left atrium openings, its blood pumps into the left ventricle through the, we are going to get bicuspid wall or the mitral wall. Then you have to remember about the right atrium. Here we have the musculopectinity, more area covering on the anterior aspect. Then vena cardi minimi, coronary sinus opening, superior and inferior vena cava opening, fossa ovalis depressed part, around the margin that annulus ovalis. That is about the total. You have to remember about the comparison of the right atrium to the left atrium. Then I have told the difference between the right ventricle to the left ventricles. And we have studied the total study of the first one. We have studied the external features and internal structures of the right ventricle. Then also the external internal features of the left ventricle. Then I have covered that is the posterior most chamber of the heart, that is the left atrium. So left atrium you have to remember, and these are the two auricles, right auricle, left auricle. So what is the blood supply of heart? So it is supplied by the ascending aorta, gives two branches. One is right coronary artery and left coronary artery. So right coronary artery arising from that is the ascending aorta. Left coronary artery also arising from the ascending aorta. So blood supply will be by the right and left coronary artery. So what are the circulations you have in the heart? You have the first one is a coronary circulation, that is a blood supply to the heart. Then one is pulmonary circulation, blood from the heart going to the lung. Then we have the systemic circulation. These are the three circulations you have to know. So whatever the blood from the superior inferior vena cava, deoxygenated blood comes to the right atrium, it pumps the blood into the right ventricle that through the tricuspid valve. Right ventricle pumps the blood into a pulmonary trunk going to the pulmonary arteries to the lung. Then four pulmonary veins bringing the oxygenated blood to the left atrium. Left atrium pumps into the left ventricle. Left ventricle, it is passing through the mitral wall, and it pumps the blood to the aorta, and that is the systemic circulation. Circulation in the heart, systemic circulation, we have the pulmonary circulation and coronary circulation. So these all you have to remember in the heart. Clinical anatomy, when you get the one's area of the chest region, how it is situated in the chest region, that is in the chest, that is the area covering the chest region we call as the area of the heart covered by the chest, that is the precordium. Then we are going to have the one that is the inflammation of the pericardium, pericarditis. Second one, inflammation of myocardium of the heart, myocarditis. Inflammation of interior lining of the heart, endocarditis. Increased heart rate, that is we call tachycardia. Decreased heart rate, that is a bradycardia. Apex beat you can palpate on the fifth intercostal space, 9 cm from the sternal margin. That is the fifth intercostal space. Apex beat you can palpate. Then you are going to get that is angina pectoris. There is a transient loss of blood supply to the heart. That is a transient, small, due to the less blood flow through the coronary artery. That is we call angina pectoris, pain in the pectoral region due to the loss of or the transient loss of blood supply to the heart. That is angina pectoris. Myocardial infarction, that is a total loss of the blood supply to the heart, leads into the death of the tissue. That is the death of tissue of the heart muscle is known as a myocardial infarction. Then lastly you have to remember that is the heart transplant. Okay, that is also you have to know about the heart transplant. Also you have to know angiography, angioplasty, all those things are related to the heart. So this is the applied anatomy of the heart. Okay, this is all about the relating about the heart.